Hello and welcome to this edition of this segment of Beyond the Politics, Queen's Park Edition, where once again, thanks to our friend Todd Smith, MPP for the Bay of Quinte and Minister of Energy, we're spending some time at Queen's Park talking to some of the movers and shakers and how they affect our lives and work so hard behind the scenes each and every day right here in the provincial capital. I'm now joined by the Minister of Health, Sylvia Jones. Thank you for joining us here today. We have so much to talk about in such a key area.
Absolutely. Welcome to Queen's Park, Paul.
Well, thank you. So looking forward, as the Minister of Health, so many areas that could be covered, but where do you see the status of healthcare right now here in Ontario, and what do we really have to do, or where do you see things moving forward from here?
I'm actually really excited. We've had some very large investments made by Premier Ford, $18 billion additional spending that's happening in the province of Ontario. And that really means investments. So investments in hospital, investments in people, investments in equipment. And so when you start to put all of those pieces together, you start to get a system that can look after an aging population, a growing population, and of course that is province-wide. You know, the Premier often talks about how we have over 50 different capital builds. Those are new hospitals, expansions, renovations, in 50 different sites across Ontario, including, of course, at Picton.
There you go. So, and I was going to segue to that later, but that's a perfect moment right now. The build in Picton and Prince Edward County has been quite some time coming, but it's taken some key steps forward not that long ago in terms of the pre-qualification and then qualifying the 4 groups who are now in a position to submit bids. So it's actually getting to the point where someone could be chosen in the near future and people could actually see the new build, which will be such an integral part of that community. Being familiar with not only the process and what the impact of the individual sites is, how exciting is it to see these projects now moving through the key steps and getting closer to becoming a reality?
Yeah, since we gave the initial planning grant in 2020, I know sometimes the community is like, why isn't it done? Why aren't we seeing shovels in the ground? But it's really important to do that planning piece because that's when decisions are made about, you know, how many operating rooms do we need? How many beds are appropriate for inpatients services? And so to your point, we now have 4 different organizations that are preparing and are waiting for a request. And basically, they will now submit their RFP to see how much they want to do this build and for the cost. So very exciting.
Now, there's also been a very special relationship between Prince Edward County and that hospital. It had one of the first family health teams, vibrant activity by the community doctors who are attached to the hospital itself physically right now. This new campus of care model as well is slightly different than some other hospitals that will be built. How exciting is that particular project, just because of the track record that Prince Edward County has in supporting healthcare?
You know, I think when communities get together and they leverage their existing resources, whether that is a hospital that has some additional space and might do some long-term care, might do some palliative, might do some primary care, leveraging those different assets within community and frankly making sure that they are grouped together is just a really convenient common sense thing for people to do, and people understand, right? If I'm going into an emergency department and what I really need is some additional assistance on a chronic illness that I have, that comes at a primary care level. So to have that very close relationship with your hospital and hospital leadership just means better care for the patient and the community.
We're entering, of course, now in basically wintertime, COVID and flu season, and of course the newest vaccines have now arrived, they're being delivered, flu shots as well. What's the messaging that's going out with that, and how important is it for people to still treat COVID, especially like the serious thing that it still is?
Yeah, Paul, you've raised a good point. I mean, we continue to see some COVID in community. What I will tell you and give comfort to your listeners is we do not see the high incidence of hospitalization. Having said that, it's really important if you are vulnerable, if you look after someone who is vulnerable, if you are concerned because of your age, to get that access to that free COVID vaccine. The other piece that we've never had before. Of course, we've always had flu vaccines, and we've always offered that, is now being able to offer it through our pharmacy partners. And in the province of Ontario, we have over 4,000 pharmacies that are offering COVID vaccines and flu vaccines. And that's, again, a very convenient way for people to go and protect themselves, protect their loved ones.
The way healthcare is delivered, you just mentioned, is changing. It's evolving. And there have been a number of new measures. Are there other things that people might not be aware of or enhancements to the system that you're hoping will catch on more or that people should be looking for as we enter 2024?
Yeah, in the ministry we call it scope of practice, which really just means as a medical practitioner, what are the things that you can do to assist your patients? So you've just mentioned one with the pharmacy. We now have pharmacists able to diagnose and give treatment recommendations on 19 minor ailments. We started that in January, and we have almost 500,000 people in the province of Ontario who have accessed that service, a service that didn't exist before January 1 of this year. So that type of scope of practice changes means that when you're in front of a nurse practitioner, when you're in front of an RN, when you're in front of a pharmacist, you now have more options to discuss, and ultimately they can send you for treatment, they can send you for scans, and that, again, is really just utilizing the existing highly trained, skilled workers that we have in the province of Ontario and making sure that they are practicing at their highest level of education.
Now, we have so many trained and skilled workers, but we're always looking for more.
Yes.
And especially if we're dealing with the backlog of procedures that were taken back because of COVID, and just in general, more family practitioners, more RNs, more RPNs. Talk about some of the things that are being doing. The province has taken some steps to expand the number of placements and also encourage post-secondary educational institutions, whether that be colleges or universities, to make more of the spots available, and also working on faster tracking for people who have credentials from other areas.
Yeah, there's a lot of work that's happening on that side in particular. So we know that the Ontario population is not only aging, but it is increasing. So we need to start preparing for that in all levels of government and certainly in healthcare. So what we've done is, and Loyalist College is one that is doing it, while we have expanded the number of seats that are available to students, whether it's RPNs, registered practical nurses, RNs, physicians, lab technicians, paramedics, with Loyalist College in particular, they are tapping into a program that we call Learn and Stay. And Learn and Stay really just means if you are interested in becoming an RPN or an RN, want to train at Loyalist, and you qualify for Learn and Stay, the province of Ontario will cover your tuition and your tuition school-related books, for example, in exchange for working in more highly needed areas. And we've had an amazing uptake on that. You know, there are so many young people who, for any number of reasons, maybe get worried or don't have the financial means to take that 2 or 4 year schooling, but they really want to practice in the medical field, and the Learn and Stay program has been a very welcome addition.
Talking more about Loyalist, how important is it to not only cultivate those relationships, but build them? I mean, Loyalist stepped in a big way for things like during the height of the pandemic, there were vaccination clinics run at Loyalist with students administering vaccinations, literally helping protect thousands of lives on a day-to-day basis. Things they weren't envisioned for before, but because of the investment, because of the capacity, because of the expertise, they can take on that responsibility. Yep. So how important do they become in terms of unlocking new ways of doing things? Like not that long ago, they were granted the research ability for psilocybin the way they were for medical marijuana before. So they're really expanding what people think of that a college can do. Mm-hmm.
It comes back to our very first conversation, and that's about leveraging what we already have in community. You know, the other piece that we haven't talked about is the expansion of Ontario Health Teams. And Ontario Health Teams are really exactly what you're referencing. It is, what do we have in our community, in our healthcare assets, and how can we better work together to make sure that that patient is not having to constantly repeat their story as they move through. So from treatment, from accessing scans, from perhaps surgery, recovery, home care, in some cases palliative or long-term care. Having all of those organizations work together and making sure that the patient isn't constantly having to repeat their story is an exciting piece that we are also moving forward with. So there's lots of stuff happening in health.
Well, thank you, Health Minister Sylvia Jones, for taking the time to talk to us. This has been another segment in our continuing series right here, Beyond the Politics.